Greetings, everybody, and welcome. It's Barry here from Inside Out, and we have a special segment for you today discussing frontline workers and the global pandemic that we're coping through right now. Without too much delay, it's an honor to be with my friend and very caring, lovely lady, Sheuli Roy. How are you, Sheuli?
I'm good. How are you?
Good. So, Sheuli, when did you come to Canada?
Actually, I came like 2012, end of 2012.
Okay. And we're going to come back to your birth country, Bangladesh, in a moment. And when did you start working as personal care support worker?
It's not very long, just like almost more than 4 years I have been working as a personal support worker.
Okay.
Yeah.
And did you also work I'm trying to remember if you also worked in healthcare back in Bangladesh.
Yeah, I work in a hospital as a patient care assistant, and it was like five, more than 5 years I have been working there too.
So with the healthcare programs that you've seen in Bangladesh and in Canada, you've witnessed a lot in the years that you've been working, mostly with seniors, I guess.
Here, yeah, it's a long-term care facility, so most of them are senior there.
Okay. And just before we talk about the real topic here and what it's like for you these days and your coworkers, can you talk about your husband's predicament now to traveling back to Canada to be reunited with you and the family? How is that going? How difficult is that?
Oh, actually, unfortunately, I have to mention that he didn't come back yet. So he's waiting for his confirmation from the embassy, like if they arrange any flight for him or the other people, then because his tour flight already canceled, and they said they will arrange another flight for them. Maybe then he will come. So he's quite okay in Bangladesh, but he's not happy because we are here. It's like you
Yeah,
understand the situation. Yeah.
I know it's a very heavy heart time for you and your family right now to be separated like that. And what was supposed to be maybe 2 week trip is now 6 weeks, something. How
Yeah, it's more
long?
than 6 weeks actually.
Yeah.
Yeah.
So, what have things been like for you at work, and how have things been changing? So you're working at the Kennedy Seniors Long-Term Care
Yeah.
Home, and you've been there for a few years, I believe,
Yeah, more
or
than 4 years. Yeah.
so okay, so you've been in the one place basically the
Yeah.
whole time. So you obviously know the people there very well, that the ones that have come in, the ones that have stayed, and unfortunately the ones that have left, in some cases, I'm sure. What's it been like these last 2 weeks or so for you?
So last actually more last 3 weeks, more than I can mention that, like when the this COVID-19 started in China. So it was not even, and then Italy, then our facilities decided that we will not allow any visitors and any mm, most of them visitors they don't allow because it gets spread easily. So we stop
And when
coming.
did that begin?
It's like starting March 1st, I think.
Oh, as early as March 1st, there was
Yeah, earliest
restricted
must. Yeah,
family could not visit
no,
anymore.
no family, no visitors, and then even no, I think they stop getting food. Sometimes for their parents, they bring food from home, so they stop allowing the foods and everything. So what they did, only if you want to see your parents, so come downstairs outside of the main door, and then they call and make an arrangement, like they want to see their parents, so from outside they see their parents and say hi. Sometimes what we do, we make a video call, because we have some like health and wellness people, they arrange the call for residents, and then it's a fixed time, I think it's called. So they arrange the meeting, and then they can contact with their parents like this way, or family member.
So starting back on March 1st, and we're now in April, so it's already been a long time, and it
Yes,
must be very trying and difficult for the clients, the
client.
patients there. What kind of conversations are they having? Like you must be starting to see a little bit of desperation from some of these people, or are they managing not too bad considering everything?
Mm,
It must be very emotional.
yes, I saw one of resident last week. He was almost crying because he loves his daughter, and every day daughter come and give him care, and then give him support, everything. So he was crying and asking when this thing will over and when I can meet with you. Then daughter is saying hopefully soon, just giving him like okay, it will go away, but I don't know when actually. He was asking us to when, but no answer. It's
Yes.
when.
Oh my goodness. When you have to face those tough questions, it's heartbreaking, I'm sure.
Yeah,
And life is very fragile, and we know that. And when you get to be an advanced age, you're worried, I guess, every day about many things.
every.
Yeah.
Yes, and we have to face all the challenges, because some people like they like their family member come and then give them support, then they eat, or some people they stop eating, they don't want to even eat because they want to see their loved one. But what we can do, we have to tell them, like some of them understand, some of them don't understand. So we have to, this is actually very challenging situation.
Are you finding, and I've heard a couple of stories just through friends, that the patients and the seniors are having to be confined to their rooms, or are they allowed to do something like come outside the room and even wave outside the building to family? Is that allowed, or?
No, they come out from the room, and then common dining room they go, but still there now the facilities is make the social distancing. So um, I'm not clear about this, how they are maintaining this thing, because couple like last week I didn't go to workplace, so I don't know. If I go tomorrow, then I will know what is the new situation, because every day they are changing the rules. So and they are not allowed to go outside. Only, as I mentioned, this the video call, or maybe phone call, they contact with their family and the loved one.
So there hasn't been where you have observed the family from outside the door on the street somewhere and waving.
Yeah, just like outside, but nowadays they are not coming, because it's like isolate, it's like everybody, they say the social distance and stay inside the home, so family also not visiting that much. They don't come, they just contact with the WhatsApp call, or the phone calls, they contact with their.
Can you tell me again, like when you're beginning your shift, the procedures you have to go through? You were telling me earlier today about that.
Oh, yeah. So actually, morning when you go to the facilities, we have to maintain the social distancing, and then serial by serial, so one by one. So our nurses are there, and they check our temperature and sanitizing all the procedures, and then we go inside, and we change whatever. Some people they change their clothes and everything. So we change, and then we go to our floor.
Right. And have you seen where some of your coworkers maybe were turned away one day because of the
Sorry,
screening, maybe because of failing the screening? Is anyone that you've seen a coworker?
last week I heard that one like I think from dietary she was not feeling well, but and then right away office sent her in, home because she said she is not feeling well. But they checked the temperature and everything was fine, and then they send her in the home and then check. I last like 2 3 days ago I called in the office and then heard that the lady is fine, just like maybe she was is her stomach upset or something. But they send her right away. Our facility always, when some issue comes, they send them right away in the home. They don't allow people who ever have fever or any runny nose or anything. They don't allow.
Yeah, it's a kind of zero tolerance right
Yeah,
now.
even they say if we feel, we don't come. Just call, let them know, okay, I'm not coming.
Before we started talking, I asked you a little bit about how you're doing to take care of yourself because, you know, we consider great people like you that are doing the front line support, care, and you know, going in for every shift. You realize and understand how important it is for us to look after ourselves. You know, even the government has started this campaign that looking after yourself means looking after others. So maybe we can take a couple of breaths together because we've
Yes.
done gratitude exercises together, and it's always a beautiful thing when we can do that. So we want to invite anybody that's watching. Maybe we can do a couple of gratitude breaths.
Okay.
Um, and if I had the music playing, I think I'm going to find it before we sign off too. The great George Harrison.
Oh,
Uh,
I remember that now.
yeah. So
It's a Hare Krishna, I think.
well, Krishna,
Or
Krishna, yeah, it's such a famous song that we all really adore. That's in mainstream music, but also it's a way of point of inspiration for so many people. But shall I lead the breath, or do you want to lead the breath?
okay, I can.
So if somebody is watching for the first time, what is a basic thing we could tell them to sit comfortably
Yeah, sit comfortably and straight your back, and then take a deep breath, inhale,
and holding the
and
breath,
holding, and then through what uh,
exhaling
exhale the by
slowly.
mouth slowly.
We'll do two more times.
Yeah, okay.
And one more time. Breathe in new life energy, oxygen, healing, renewal.
And take out all the negative energy.
I feel
Thank you.
better already.
Yeah.
Yeah, I mean, imagine if people could do that. Like that only took us in real time, maybe 90 seconds, 1 minute, something like
Yeah.
that.
Hmm.
And people can probably see how refreshed we feel, and hopefully they can benefit from that. So let's just one more thing on this topic is to discuss other things you're observing out there. We know, of course, for people, the long-term care facilities with seniors right now are really being hit hard. And you had mentioned to me that there were other long-term care facilities not far from either home or from
Yeah.
work. Um, and what and we heard news that in the province of Ontario, there's been a number of homes affected now, and it's my goodness, I can't begin to imagine what that's like. What have you heard or seen?
Some of them just from the news and my facilities too. We heard that some long-term care they have like one. I think I heard that it's like visitors come and they got the uh, COVID-19 from those visitors, and like 8 people affected and 4 died there. And then other facilities, I heard that somebody is like a COVID-19 positive, and rest of them. So that's why the long-term care are very like I want to say all the frontline workers like fighting with the it's like that fighting the virus face on and are challenging like achieving the sorry, okay, I'll mention one thing here. So just I
It's okay.
mention like yeah, so I want to say like all the frontline workers like that are who are workers that are fighting the virus
Yes.
face on and are achieving their results. So I encourage all the workers and then say people please stay at home and keep yourself safe and people around you safe as well. So like I know if we work together, then we can get through this chaotic situation. I think so.
What is your husband and your daughters? What are they saying to you when you're going off to your shift or when you come home?
Yeah, they don't say, they always encourage me go and help people as much as you can. And then like but uh, it's like maintain the social distancing and stay people just like please stay at home. And then we actually if people stay at home, then the frontline worker can work and then give people more support. If we are sick, we cannot give them support, so that's why we have to maintain the social distancing. And then it's the better way to stay at home. So my family also encourage me doing thing, and they are doing the same thing. They are staying at home and then help me to work for the other people.
Yes, absolutely. We help others by staying at home, and I think that's a really important message. And just not an important message; it's a critical message. It's the number one priority that supersedes. It's ahead of anything else right now. If you out there are watching this, the way you can support my good friend Sheuli here and and her family and many other frontline healthcare workers. Please listen to this advice. This is not a dress rehearsal, right? So this is not not an exercise or practice. This is reality that that they have to face with, you know, with their masks and sanitization and scrubs and all kinds of protective wear and eyewear, I hope. And we really want to pray for everyone and for the beautiful, amazing souls like my friend Sheuli here, you know, and that they can, you know, do their job without too much worry and stress, because that's the last thing we all need right now is to worry more. So on a happy note, I've got a little treat for us. So you're brave and beautiful as always, Sheuli. So thank you for doing this. You're amazing. And so I've got a little something to maybe cheer us up. Let's see how this goes. If I can-
Wow. It's a nice song.
Well,
George Harrison.
I think in closing for now, you know, we want to be saying hallelujah soon, that this will all end.
Yeah.
And thank you for this, and be safe, and you know, take care of yourself, and let's practice more breathing together.
Okay. Yeah. Thank you.
Okay. Bye for now.
Bye for now. Thank you.
Thank you.